Hi everybody, my name's Chevonne. I'm 29 years old and I've had HS for over 12 years. I'm going to talk a little bit about my experience through an HS surgery. So the surgery I had was a left axilla extraction with flap, and that just means my surgeon removed all the affected skin and tissue from my left armpit and pulled skin from my back to replace it. It was a pretty large area, so it was from the front of my arm all the way around to the back. And she closed with temporary stitches and a temporary drain, which is just a short tube with a small bulb that helped to remove the pus and blood because it was such a large area. It was a day surgery. It was only about 2 to 3 hours, so I went home that same day. But I was set up to see nurses every day who would help change the dressing, check on the healing, and after a few days, they removed that drain. After they removed that drain, I started to see them every other day, all the way up until the wound was fully closed, which took about a month and a half. 2 weeks after the surgery, I had my first follow-up appointment where they removed the stitches. About 3 weeks after that, I had a second follow-up appointment where my surgeon thought that the healing was great. She loved the way it looked and I loved the way it looked. It's been about 6 months now since I had that surgery and I haven't had any issues. I have lost some feeling at the surface on the skin where the incision is, and there is some scarring, but it's such a small price to pay to not have to deal with the HS wounds that were there before. So I hope this eases somebody's mind that's a little bit nervous about having surgery, and I want to thank everybody for listening. Bye.